Well, first of all, it was a national direction, I suppose, directive. But at the end of the day, you used to regularly see women coming back to clinic what seemed like forever. So you come back every 3 months for the first year, every 6 months for the next 4 years, and every year for the rest of your life. And it was just a terrible waste of everybody's time. You come to clinic, anxious as anything, and then the doctor, you queue for God knows how long to be seen, have to pay for parking, take a day off work, and then you see the doctor for like 2 to 5 minutes, and then you go out going, that's it? And for no benefit, just a lot of upset. For one, it gets rid of all the follow-up appointments and people can be set free. That's how I like to see it. Whether they perceive that they're being set free in that same way is difficult to say, because at the end of treatment, people feel like they're being dumped. So for me, it's got to be around eliminating that feeling and absolutely consolidating, giving them a chance to debrief what they've been through and recognise that they're not dumped, that we're all still there, but it's now time for them to take the lead, get their lives back on track, but know that we're still there. Well, the biggest challenge has probably got to be, first of all, funding, which we were lucky in Leeds eventually that we got CCG funding at that time, but then it's the administration. I can't stress enough to do not underestimate how much administration it takes to put these events on and how consistent and coordinated it needs to be. So good administration that must be funded and must not be put on the shoulders of the CNS. Plan first, get your administration and funding in order, and don't be scared to use volunteers. In Leeds we've been so lucky to look at a programme with a facilitator who herself had lymphoma. I think she's called Karen, and so plan it, prepare it, look at what's already been done and make it as interactive as possible and self-empowering. So interactive and self-empowering, massive.